There's a lot of drama surrounding Johnny Depp and Amber Heard, and some of this involves serious medical issues. We'll get to the bottom of it on this video. A few years ago, Amber Heard decided to go to Coachella with some of her friends. Well, at the time, she and Johnny Depp were separated and having major marital problems. So while Amber was gone, Johnny decided to go back to their penthouse apartment to pick up a few things. Well, he called the security guard to let him know he was coming, and the security guard sent him a photo of this. That is reportedly Amber Heard's poop. Well, according to Johnny, Amber took a deuce on his side of the bed because she was angry with him. Well, Amber allegedly denied that it was her poop that was on the bed, but it was actually the poop of their two dogs. But the fact is that their dogs are teacup Yorkies. Do teacup Yorkies make poop this big? I don't think so. So what are some of the health consequences of somebody pooping on your bed? Well, there's an urban legend that if you fart on someone's pillow, you can give them pink eye. And there's a little bit of truth to that. There are bacteria, viruses, and even fungi that are present in our poop. And it's true that if you touch it and then let's say you rub your eye, you can transfer those pathogens to your eye, causing conjunctivitis, otherwise known as pink eye. But even worse is that if you touch the poo and then you touch your mouth. That's how you can get fecal-oral transmission and develop horrible types of gastroenteritis. There are bacterial pathogens like E. coli and Salmonella that can be spread in this manner. You can also get hepatitis A from fecal-oral transmission as well. And possibly the creepiest of all of them is that you can get tapeworms in this fashion too. Tapeworms are parasites that live inside your GI tract, and they lay eggs, and those eggs go into your stool. Well, it's possible that if Amber Heard had tapeworms, she pooped on Johnny's side of the bed. If Johnny touched the poop and then touched his mouth, he could actually ingest these tapeworm eggs and get tapeworms himself. Now, it's extremely unlikely for that to happen, but it's theoretically possible. Now, all of that being said, as long as you wash your hands thoroughly after cleaning up those sheets, it's very unlikely that you or Johnny would get sick from Amber pooping on the bed. Well, Johnny Depp claims that while he was filming Pirates of the Caribbean in Australia, Amber Heard was so upset with his drinking that she threw a vodka bottle at him, hitting his finger, cutting off the tip of his finger, and crushing some of the bones. And there's even a photo of him from the hospital where you can see a picture of that severed portion of his finger next to him. Now, although he told doctors initially that the tip of his finger was cut off by slamming it in accordion doors, his story changed. So the big question is what really happened to Johnny Depp's fingertip? Well, I am a fully trained hand surgeon, and I have performed hundreds of hand and finger operations throughout my training. And although I don't do these operations anymore, I am definitely well versed in them. I've treated many fingertip injuries and even fingertip avulsions and amputations like this, and not a single one of them was due to somebody throwing a bottle at the finger. Usually these types of amputations are caused by sharp instruments, like somebody sawing through wood and accidentally sawing a portion of his finger off. So although I guess it's theoretically possible that throwing a bottle, which can have sharp edges after it breaks, at his hand could sever the tip of his finger, it is not something that I think is very, very likely. So how do you treat it? Well, the first question that you need to answer with an injury like this is there damage to the nail bed? The nail bed is the skin that lies underneath the fingernail, and that is instrumental to creating the shape of your nail afterwards. If it has been irreversibly damaged, it's possible that the nail may not grow back at all, or if it does grow back, it could grow back and curl around the finger or look like a talon. So if the nail bed is not involved, how would you treat that type of an injury? Well, it's not as simple as just taking that end of the finger and suturing it back on. That is not going to work because that fingertip is likely too thick for it to actually grow in sufficient blood supply to heal. So normally in these situations, the end of that finger is tossed in the garbage and the remainder of the finger is sutured up. Now, if there is some bone that is sticking out from the end, you can't just leave the bone sticking out. You have to cover it with skin and fat, and we can do that with a VY advancement flap. And here's a diagram of it right here. In this procedure, you take skin from the proximal part, the part of the finger that's closest to the hand, and move it outward to the distal part to cover that bone. Well, Johnny and Amber are definitely not compatible, but that doesn't mean that they should stop looking for love. In fact, I recently reacted to a video of a woman with the world's largest booty who went on a blind date. Yes, she was looking for love, but was her blind date looking for love in somebody with a tush as massive as hers? Watch the video right up here where I react. It will entertain and amuse you. If you've been enjoying my videos, please subscribe to my channel, and always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.